So we're just having a conversation?
Yes.
Okay.
And I will introduce the conversation. It's a conversation I call Attempted Intelligence. We're here with Michelle Ford, and what I'd like to do, so first of all, let's just be free and say that we work together.
Yes.
At your clinics, which are Grandview Massage in Cambridge and Paris. And what I'd like to do, in maybe as succinct a way as possible, is talk to you about being a business owner and the way that you interface, not just with the business or with the clients, as well as with people who work within the clinics. I don't know, would you consider the term staff to be the most appropriate term for the therapists that work in the clinic?
Yeah, I use the word staff. Unless
Okay.
we're out together, then I say my peers.
Yeah, fair enough. Because realistically, everybody's in some form of manual therapy, right? So, and that's why I ask it, because depending on how you view it and the words that you use, they're the ones that are valuable to you.
So from a financial point of view, they're contractors.
Yes. Yeah, independent subcontractors, is that correct? Yeah. So when did you start the clinic?
2004.
Okay, and where did you start it first?
Here at the Grandview Medical Center. So we started out with a 3-room space. I took over for somebody who used to own it.
Was it a massage space before?
It was, yeah.
Okay.
Yeah.
Yep.
Do you want the whole story?
Well, I mean, 2004 is good enough.
Okay.
Started 2004, 3 rooms.
3 rooms.
No admin support, and then it grew.
Right.
And then you took more space.
Right.
That's fair. Okay. Now, you started that in 2004. Did you already have a view of how you wanted to interact with other therapists that were going to work in the space? Like, did you have that? Did it come over time?
Yeah, I saw how other clinics worked and just...
What you didn't like.
Yeah.
And you said, I won't do that.
Right, and I took over for pre-existing, so I kept the same business model. So I'm kind of lucky that way.
Okay, so there was some degree to which you'd already had some insight as to how many therapeutic businesses run, and you didn't like it, and you said, I don't want to do it that way. And then also the one that you took over here in the Grandview Medical Center already had what would be considered a good business model? Did you have to tweak anything?
Well, it was smaller. There was only 3 therapists and 3 rooms.
Yep.
So then we started opening more hours and maybe 6 therapists in 3 rooms, making better use of the space.
Yep.
Yeah.
Okay.
The typical model, it's like a 65-35 split for the therapist and the clinic.
My understanding very early on was that the more standard split is usually 60-40. For massage therapists in particular, because the admin support is higher, because they will often not only do the bookings, the billings, and the laundry. But in the case of yourself, when you took over, there was no admin support. So you were probably doing your own billing and your own laundry or maybe shared laundry. Is that fair?
I still did everything.
Yeah,
Yeah, and I think the 60-40 really is more north. Like around here, it was always 65-35.
Really?
Yeah,
Okay.
I think that's more of a Toronto thing.
Well, fair enough.
Yeah.
Woohoo, Cambridge.
Yeah.
But that said, so maybe a split that is a little bit more beneficial to the therapist is something that you do appreciate. And then also, depending on the modality, if there's less, say, supplies required, so less requirement of sheets, less requirement of laundry, you change the split. Is that fair?
I've never changed the split.
No. So for massage therapist, you're stable. But I'm saying if you had a TCM doctor come in, would you consider a different split in that circumstance?
Yes.
Right. So for osteopathy.
So even with osteopathy, we don't use as many supplies,
Yeah.
so the split's different.
Yeah. So now the rationale for the split being different, obviously, is the supplies on that level. But the rationale for the split being maybe slightly more in favor of the practitioner. What drove that?
I think just me wanting to be fair.
Okay.
And staff retention.
Yeah.
Yeah.
So the reason I ask it that way is because we've obviously talked about this before in some way, but it seems like what you aim at as often as you can is the people that are around you to be in as positive an environment as possible and as happy as possible, right? So give them less reason to complain.
Right, so I've had the clinic for almost 19 years, and I have one staff member I've had for 19 years since the beginning.
Yeah.
And many others that close to a decade. There's not a lot of turnover here.
Yeah.
It sometimes appears that way, but turnover is typical in a clinic, especially since massage therapists seem to be 30-year-old women and they're having babies.
Yeah, fair enough.
Right?
Fair
But
enough.
I would say my turnover is low.
Compared to other peers that you're aware of.
Right.
Yeah. And and the reason I bring it up again is because you actually seem to aim at trying to make it as positive for everybody as possible, and maybe in some ways, maybe say on a spreadsheet, to somewhat to your detriment. Like, you could make more, but if I'm not mistaken, what you aim at is saying, I've got this space, let's see if we can have happy people in here as often as possible, and for as long as possible.
Yes, my accountant is very unhappy with me.
Fair enough. But you sleep fine at night. At least in relation to the business. Maybe other things keep you up, but whatever.
Right.
That's just life. That's humans. But I think the value is that you have a hierarchy, and your hierarchy seems to be human first, business as important, but the human being happy is what drives good business in the long term. Right? So the way that I tend to describe something like this is a model that is relationship driven. So it's not necessarily about dollars per transaction, it's dollars per relationship. So if we are in a business relationship for longer, we'll make more money in the long term. Whereas if you milk me for money, or I milk you for money, then we might make a lot of money in the short term, like each of us, but then the relationship breaks up because it's like, well, you're screwing me, well, you're screwing me, right?
Right. I guess I didn't set out with a model. I didn't know that was a model. It was never my intention to...
I don't know that it is a model. It's the way that I think. It's probably one of the reasons we get along.
Sure,
right?
Sure, yeah.
Because you seem to be more about paying attention to the individual to the best of your ability, and the individuals are variable, right? The people that work in these clinics are not the same as one another. Right? They have the same profession, but they're different.
Right.
Right? And do you attempt to interact with them differently depending on the situation?
Sure. It's like having children. Some have higher needs, right?
Sure.
So some have higher needs. So I might spend more time with them, have more conversation, reach out more, send an email. Yeah.
And it's just more what I would take as more evidence that you are person first, business second, right? So the business works because the people are happy and they want to be productive and they want to continue.
It's a lot easier to manage happy employees.
Yes, because there's no fights, right? Oh, well, I mean, there might be fights, but they're not because you're trying to purposely screw anybody.
And again, I think looking back on other clinics, there has been very few conflicts between my staff.
Yeah. Well, I mean, not that I've seen it. I've been here since 2017, and it's now 2022.
Right.
So I haven't really seen any particular conflicts.
Yeah, it's very rare somebody approaches me and say, I have a problem with so-and-so. That doesn't happen very often.
No. And I think another part of that is people are free to be themselves. And that's kind of the general air of the clinics.
And I encourage them to talk to each other instead of coming to me to solve the problem.
Yeah. Even with that desire to encourage, I don't think it's really something that pops up often that I can tell.
No.
Yeah. So, again, the reason that I appreciate the fact that you're willing to talk about it, and just even in broad strokes, the idea, because I've had varying clinical experiences, most of which are actually good, right? An early clinical experience in my professional life as a kinesiologist was an odd one for me, because there was definitely dollar figure per transaction first. Right? How much money can we get out of this, the set of individuals, the set of patients? What are their insurance benefits? How much can we bill? Right? Max bill everything. I had that experience that I didn't appreciate early on as a kinesiologist, and then moving into being an osteopathic practitioner, my early experiences were basically myself, right? With very, very little oversight. So I was just renting space.
Right.
And then my first experience in a clinic where maybe somebody else had a little bit more input, such as yourself, has just been positive, right? So I feel quite happy and free to be myself. I can say wacky things to people, with no malice, but my humor can come out, and it's not a problem.
Like you said, I wasn't even aware of some of these things until you pointed it out to me. I thought it was just normal to try to make everybody happy at work and not think about the money. And we should probably have more staff meetings. We used to have staff meetings, but they would just end up being a party because we often didn't do constructive criticism or solve too many problems.
Well, I think, so I appreciate that you say that it was just normal. So what it seems to be is that it's native to your personality. It's natural to you to view the world that way, right? For varying reasons, whatever they may be. But other people view it a different way, and they behave accordingly. So the fact that I've had those experiences and pointed it out to you, and I'm like, this is a way to describe what you're doing. You're like, oh, that's cool.
Right.
But then also when you have staff meetings, and the fact that they just turn into parties, because I would predict that there's not much to solve. Right, so people don't need much constructive criticism because for the most part the massage therapists are consistently busy when they want to be.
Right.
If they don't want to be, well, maybe they're not as busy. But if they want to be in the clinics that you run, they're busy. Right, so they don't have time to mess up. They do their work. Their clientele is happy and getting positive results, and there you go. So of course it turns into a party. There's nothing to complain about. There's nothing to criticize in particular,
right.
Because everybody is free to be themselves, is allowed to build their interactions with patients the way they want, and it goes well. Right. So is there anything else as far as running a clinic that you'd like to touch on, or?
Do you mean like as far as giving advice, or just some experiences I've had along the way?
Experience or advice, whatever kind of floats your boat, because I think I've built you for the information that I'm looking for, because obviously I'm trying to prove a point.
Over the years, again, almost 19 years, if there is somebody who doesn't fit in, they start to see it, they start to know it, and eventually they leave.
Yeah.
I haven't had to fire anybody.
Well, again, I think that's the freedom to be yourself. Right. So the ability to identify the mismatch between oneself and the environment is helped by the fact that you're free to be you, and when when you feel safe to be you, you're like, oh, I don't fit here. I want something different.
Right, and I think I attract the right people in my interview process.
Sure.
When I do an interview, this is something that blows people away. They don't give me a massage.
Yeah.
So most clinics, you have to give the owner a massage.
It feels a little creepy.
It feels creepy, it makes people nervous, and I don't get really an impression of them. So I do an hour discussion and interview where I get to know them, and I hire based on personality, not skill. Skill can be taught, but personality can't.
And to be fair, in the massage world, I think skills are probably at an acceptable level to run a business for an individual. So I think most people who've gone through RMT training, their hands-on skills are at an acceptable level.
Yes,
it's very rare that you find somebody who's horrible and hurting people. Like I don't think that's normal.
Yeah, it's regulated, and it's difficult to pass the board exam.
Yes.
So if they pass the board exam, they're doing well. And again, I can teach them any skills they're lacking in.
Yeah, and usually it would be them, if they're able to identify something that they need help with, they'd ask, right? So I don't think that that's something that's common. And the other thing is that, as you said, you're trying to know the person. So that also seems to fit with the model that I would use to describe you. You're person first. So if the person's going to be cool and fit, you're good to go.
Right. So if I'm interviewing somebody and I can tell right away that they're not going to be a good fit, I might discourage them. I might say, I don't know if you're going to like it here. You know, we're not sticklers for the rules. I don't make people sign contracts. You know, and if that's what you're looking for, if you're looking for a concrete contract, then maybe this isn't the place for you.
Yeah, and I'm definitely not one of those people. I'm not a stickler for words on paper.
I'm a handshake person.
Yeah, I like to write words on paper, but I'm not a stickler for them as far as governing my behavior moment to moment. So I think the main point that I was trying to make in having the conversation with you is that you are person first, and business does come along with that, and you haven't had any terrible business flops or fails. Everything's kind of chugged along. Maybe it could be better as far as, say, dollars on paper, but you've led a happy, fulfilled, successful clinical life as a leader of 2 clinics now, right? You've never had issues.
No.
Yeah, and the reason I want to put it out there is because many people end up running into business issues because they're trying to run a business, and the hands-on therapy of all kinds, whether it's massage, chiropractic, acupuncture, osteopathy, they're all person-to-person interfaces. So people are the dominant interface. So if you're going for a business interface, dollars per transaction, and trying to optimize that stuff, you're forgetting the humans.
Right.
So the humans are actually the thing that's driving the productivity, driving the return, right? So the attrition rates versus return rates. It's the people, right? So the relationship is more important. The therapeutic relationship is more important than the dollars on paper. You hear about in varying settings, you know, the benefit of the therapeutic relationship, but then you'll hear other people in chains of clinics. I don't know if you've heard this, but they say we want to create a service that does not rely on the individuals. We want to be able to plug any individual in and have the person be willing to come back, because it's the service that they want from the clinic more than the relationship. Have you heard that before?
I have, but I think people still like making a connection.
100%. I've never seen that work the way that somebody wants it to work. When it's like, regardless of practitioner, they should come for the service. I haven't seen that work particularly well.
Are you referring to sort of the barbershop kind of model?
Not absolutely. So like a barbershop would be first come, first serve, no real appointments. Not necessarily.
Okay.
Right? Because it's not, these aren't haircuts.
Mm-hmm.
These are people coming in with subjective complaints, and we're trying to be somewhat objective and find a match between the objective stuff and their subjective complaints. If they match well, we help them out, they feel better. Sometimes objectively they're better, and subjectively they're the same. It's like, oh, you need something else.
Also, on a side note, the first rule of business is supposed to be location,
Mm-hmm.
and this is probably
A good location.
one of the best locations in town for sure. Hespeler Road is busy.
Yeah, for sure.
And the doctors. It's a medical center with 15 doctors upstairs.
Now the other clinic being in Paris, in downtown Paris, not being in a medical center, but it's still doing well because it's got good foot traffic.
Right.
Yeah. I think the person first connection, relationship, practitioner to patient. Now it can be variable. Patients can be happy with multiple practitioners, but it's the people first, it's that relationship first versus the business first. And that's probably why you haven't had, or I would predict that that's why you haven't had any major stumbling blocks and you've been able to go to sleep at night based on the business. I'm sure other stuff pisses you off because that's life, but okay. Well, thank you very much. We'll conclude this for now, and if you're looking for either one of us, Grandview Massage in Cambridge and Grandview Massage in Paris, if you need high quality osteopathic care. Thank you kindly. I end with high fives.